Hello everyone, welcome to another episode of USTM podcast series. I'm your host PIMCH and today's episode is a special one. It's World Diabetes Day, a day dedicated towards raising awareness, supporting the ones who are suffering from it, and highlighting ways in which we can make a difference. Joining us on this show we have Dr. Ibn Latif, a Chief Casualty Medical Officer and Diabetologist from PA International Medical College and Hospitals, Meghalaya. And he's here with us to discuss everything from managing diabetes to busting common myths. So whether you are suffering from diabetes, supporting a loved one, or just curious, we have got something here for everyone. So let's welcome to the show Dr. Ibn Latif. Welcome to the show, sir.
Thank you, Vipanchi, for inviting me for this talk show on diabetes mellitus.
Dr. Latif, as we begin with the podcast, let's start with the basics. What is diabetes? It's a term we often hear, but what does it really mean?
Actually, diabetes is a chronic metabolic disease. Actually, it is characterized by elevated levels of blood sugar in the human body. And if the blood sugar increases in a long time, it leads to the damage of the blood vessels, kidney, liver, and heart. This is called the diabetes mellitus in lay term, actually. So, why we have diabetes in a normal person? Why the sugar level rises? This is the main question, actually. Actually, when you eat some pakora, like there's a biryani or chicken, when you eat the chicken, pakora, biryani, it goes inside our body and it is break down into sugar and sucrose, actually. That sugar and sucrose, the sugar should go inside the cells of the body, and it acts as a fuel and gives energy in the human body. But and this sugar is when it goes inside the cells, it is helped by insulin. Actually, insulin is a hormone that is secreted by the pancreas from the beta cells. Actually, this insulin actually regulates the blood sugar in the human body, and it helps in the transport of the glucose to the cells. And this is simply we can call it diabetes mellitus, technical terms.
Thank you, sir, for explaining the term in such a simple manner. Now let's get to the heart of the condition. Sir, diabetes comes in different forms, right? So what are the main types of diabetes and how they differ from one another?
So actually there are three types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes. Type 1 diabetes, it occurs due to deficiency of insulin in the human body. Actually the insulin is a hormone secreted by the pancreas. Due to the deficiency of insulin, there is this type 1 diabetes occurs actually. And the treatment of this type 1 diabetes is you have to give insulin from outside actually. Insulin is required. And in type 2 diabetes mellitus, it is due to insulin resistance. This is the difference actually. Our cells in the liver, fat, heart, all get resistant to insulin. Due to insulin resistance, this type 2 diabetes mellitus occurs. And another is gestational diabetes. It is a gestational diabetes occurs in pregnant women actually. This in pregnant women there is a weight increases in the woman actually. Pregnant women there is this diabetes occurs in pregnancy, but it can be reversed after the delivery of the baby. Diabetes actually decreases. It can be reversible, this gestational diabetes. And another diabetes is there, it is maturity onset diabetes of the young. It is actually, this diabetes occurs in the children and adolescents due to obesity, sedentary lifestyle, mainly obese, there are more obesity. And type 1 and type 2 diabetes especially occurs in the middle-aged and the elderly. And type 1 diabetes also occurs in the children nowadays, but nowadays the middle aged and elderly also occurring in this type of diabetes, type 1 diabetes. So these are the three types of actually diabetes.
Thank you, sir, for explaining about the different types of diabetes. Now let's talk about the causes. Is it just genetics or are there any other factors at play? Could you please break it down for us?
Well, the cause of diabetes actually in type 1 diabetes, the main cause is idiopathic and immune mediated. And in type 2 diabetes, it is a defective function of the beta cell in the pancreas. And also there is excess growth hormone, and there is a thyroid hormone, excess thyrotoxicosis. And obesity is also a factor of cause of the diabetes, type 2 diabetes. And there are also environmental factors also, the metabolic factors of for increase in sugar in the diabetes, genetic susceptibility also there. And there are many causes in type 2 diabetes, mainly the excess growth hormone, thyroid hormone, excess. There may be excess in thyroid hormone in the body, and there are some congenital anomalies like Turner syndrome, Klinefelter syndrome, which can lead to type 2 diabetes.
Great insights, sir. Now let's talk about the signs and symptoms of diabetes. Are there any early signs or do they tend to sneak up on you?
Well, the signs and symptoms, there are many signs and symptoms in diabetes mellitus. Actually, excess hunger, excess urination, and then weight loss. There is fatigue, tiredness, and excess urination also is there. So all these can occur in diabetes mellitus. Excess hunger and excess urinations are in diabetes mellitus, both in type 1 and type 2 diabetes mellitus.
Sir, as you have talked about the different signs and symptoms of diabetes, now let us talk about the diagnosis. So how is diabetes diagnosed? Are there any specific tests or criteria that is used to detect diabetes early on?
Well, for the diagnosis of diabetes mellitus, the American Diabetes Association has classified some guidelines. According to their guideline, we can say that there is diabetes mellitus if the glycated hemoglobin is greater than equal to 6.5%, and fasting blood sugar is greater than equal to 126 mg per dl, and the oral glucose tolerance test is greater than equal to 200 mg per dl after 75 gram glucose load.
Thank you, sir. Now let's talk about something that is very crucial for someone who is suffering from diabetes. How does a patient keep their blood sugar levels under control, or how do they manage their diabetes?
Well, in the management of diabetes mellitus, let's come to the investigation part. For investigation, we have to do fasting blood sugar, postprandial blood sugar also. Then we have to do urine for albumin, microalbuminuria test, and also we have to do the kidney function test. And these are the investigations we have to do for diabetes mellitus. And we have to see also the BMI of the individual. Actually, if the BMI, body mass index, is actually, it is calculated in kilo weight in kg divided by in height square meter. If it is more than 25, then we can classify it as diabetes mellitus. The individual will having diabetes mellitus because more than 25 it is, but actually the BMI is actually from 18 to 24. Actually, the body mass index, normal BMI is 18 to 24. We should see the body mass index of the patient also. The management also depends on the lifestyle factors. We have to see the lifestyle, diet, and the diet should be maintained. Again, the lifestyle changes, the walking, swimming, cycling, and it should be done at least for 30 minutes and 5 days a week. Then again, the management part again, overeating is not good in diabetes mellitus also. It leads to some obesity. The abdominal mass is increases, then BMI also increases. So in dietary part, if we take some carbohydrate, less carbohydrate, and we don't have to take sweeteners actually. Low calorie diet we have also taken for this management part. Food actually low calorie diet. Because suppose a patient is not controlled by diet, then oral anti-diabetic drugs should be given actually. There are many oral anti-diabetic medicines now available actually. They can be classified as SGLT2 inhibitors, sitagliptin, linagliptin, biguanides, metformin. Then again we can classify as sulfonylureas, glimepiride, and gliclazide, then glitazones, thioglitazones actually, and GLP and antagonist is also coming like semaglutide. It is a wonder drug now called in anti-diabetic drugs. These are all the treatment prospects of the diabetes mellitus. But nowadays, mainly common drug is metformin. It is given for diabetics.
Thank you, sir, for breaking down the management process of diabetes. Now let's talk about some lifestyle factors. Smoking and drinking are something that a lot of people struggle with. So how does it affect the patients who are suffering from diabetes?
Yeah, actually, smoking causes diabetes mellitus, and this is a term like metabolic syndrome actually, or syndrome X. Actually, metabolic syndrome is related to high cholesterol levels, impaired fasting glucose, and there is hypertension. All are related to metabolic syndrome, and this may cause the smoking. We can say that smoking causes diabetes mellitus, and for alcohol consumption should be reduced actually for the weight reduction. We should see that alcohol should be reduced there, and the pressure should be maintained, blood pressure should be maintained, and excessive alcohol is also dangerous for hypertension. So all should be reduced actually. So minimum alcohol should be consumed in a very less amount actually. That's the main thing about tobacco smoking and diabetes.
Thank you, sir, for shedding light on how smoking and drinking affects diabetes. Now let's talk about the complications of diabetes. If diabetes isn't managed properly, what are some of the possible long-term consequences and how can they be prevented?
Well, the complications of diabetes are actually macrovascular complications and microvascular complications. In macrovascular complications, there are cerebrovascular diseases, peripheral vascular diseases, and in microvascular complications, there are retinopathy, neuropathy, and there are EGF or estimated glomerular filtration rate in the kidney should be assessed. So there in the eye, there may be cataract, there may be retinopathy. All these are microvascular complications. There may be nephropathy, the kidneys may be affected. And these are all microvascular complications. But in the microvascular complications, there may be stroke, there may be heart attack, and all these can be classified into macrovascular complications.
So, Dr. Latif, you have served overseas for about 13 years in countries like Saudi Arabia and Kuwait. Could you please share your experience, sir?
Well, it is a very interesting question you have asked me. Actually, I was working in Saudi Arabia for the last 13 years, and I was working in a government hospital. It is Al Quwayr government hospital. It was 100 kilometers from the Riyadh region. I was working in the internal medicine department. So there in the OPD, I used to see many diabetics people coming there, where obesity, due to obesity, sedentary lifestyle, and many patients comes, young patients also comes there to see me. I also treat the patients. There I used to get many maturity onset diabetes of the young children, so I used to treat them also. It was actually in the OPD I used to see around 150 patients, diabetic patients. In Kuwait also I was working there also in the general hospital I could see many diabetic patients. There are many Iraqis come, Iranian people comes, and also from the Russian people also come there, overseas people. All are diabetic. Due to actually the diabetes there is due to sedentary lifestyle and overweight, and they are taking fatty foods, junk foods. All are making this diabetes. Actually, the diabetes is overcrowded in the Middle East. Actually, now more than 101 million people may be suffering from in diabetes there. And 12.5% is the overall ratio there in the Middle East. Actually, the diabetics, it is increasing day by day.
Thank you, sir, for sharing your valuable experience with us.
Thank you, Vipanchi, for calling me these talks on diabetes. Thank you very much for your invitation.
Thank you, sir, for being here with us today. You have shared so much valuable information about diabetes, its causes, symptoms, management, and importance of prevention. I know that our listeners are walking away with a better understanding of the topic and how they can take action to protect their health. And to all the listeners out there, remember, knowledge is the power. Whether you are managing diabetes or supporting someone suffering from it, making small lifestyle changes and staying informed can make all the difference. If you found this episode helpful, please share it with someone who would benefit from the information. And don't forget to subscribe to USTM Voice so that you don't miss the further episodes.